Interacting with children. Tips to facilitate vision screening in school-aged children.
Interacting with children. There's many factors that need to be considered when interacting with children. Some of these you consider no matter what situation you are in, but for the purpose of vision screening, these will be the most important ones to consider. Chronological age, developmental age, child's emotional state, child's current situation, child's motivation and perception of the purpose of the interaction, child's familiarity with the location and materials used, communication strategies, and relationship between child and tester. If we're looking at the developmental age, we have to remember that it's not always the same as the chronological age. Often you'll find variances in children of the same age. For example, you'll hear the expression, a young 8-year-old. We have to be able to be aware of what is actually the developmental age of the child. You may be working with a child in JK that is 3 years old that knows their letters. Or, again, you may be working with a child that is in SK that is 5 but doesn't know its letters yet. So these are things that we must consider. If we're looking at the current situation, we have to consider, is it recess time? Is it lunchtime, just before lunchtime? Are they hungry? Is it the end of the day? Are they tired? All these things come into play. The child's emotional state. Are they a quiet child? Are they a busy child? Are they shy? Are they timid? All of these have to be looked at and made assessments quickly when you first meet them. We also have to look at the motivation and perception. Does the child actually want glasses? Are they perhaps malingering? In which you may need to check and recheck by switching things up when you're doing the vision tests. The other aspect we have to look at is if the child is older, don't assume that they actually do know their letters. Familiarity with the room, the tester, is also something we have to consider. Is this in the classroom? Is it not in the classroom? Is the child familiar with having a test done with their eyes? All of these come into play and must be considered.
For rapport, something that emerges when two people interact to form a positive impression or attitude towards one another. Rapport is essential to working with children, especially in this environment. You need to be able to build rapport quickly with the children that you're interacting with. We're not looking for a therapeutic rapport here, but more of a simple interaction. It's important because for eye screening, we need participation from the patients, and so building rapport helps to ensure the participation. Something simple but very effective is a smile. So one way to build quick rapport is to smile when you meet a child or a family. It's so simple, but remember, when you appear relaxed, this also encourages the child to relax as well. If you look upset or tense or anxious, the child might mirror these behaviors.
Introduction. Most important thing to build a relationship between a child and tester is to introduce yourself. Children like to know who they are interacting with and the reason they'll be interacting with you. Approach the child at their level. If we have a smaller child, it's good to actually bend down on one knee possibly, but in a lower position so that you're making eye contact. And always explain the purpose of your interaction. For example, in the primary grade, JK to grade 3, you might say, today we're going to play some games and see how well your eyes see. In our junior and senior grades, grade 4 to grade 8, today we are just going to do a vision test. For those children, majority of them understand what that means. If it's possible for the primary grades, be actually sitting down. Again, we want to make sure that we're at eye level with the children and not standing looking over top of them. When describing the purpose of your visit, you must take into account, again, the age and grade of the child. That's always the number one thing. Pacing. Match your voice and read the body language of the children. You generally have two types of children, the quiet, timid, little eye contact children, or upbeat, open, and inquisitive kids. What you're looking at is what you see as the child enters the room. Your voice needs to follow the similar pattern of the child. So a quiet, timid child will speak quietly, and the visual upbeat one will usually be using a more loud or rambunctious voice. When the child is speaking quietly, it's good for you to also speak quietly. If the child is speaking upbeat, you can also speak in a louder voice. It's a good idea to ask the child if they've ever had their eyes checked before. This will also provide you with information on whether the body language of the child is in response to the unfamiliarity or familiarity of the test. Ask simple and direct questions, which allows for children to increase their confidence and may help in redirecting a child's attention. For example, if you're working with a timid child, instead of saying, "What's your name?" which is an open-ended question, you could simply say, "Are you Susie?" or "Are you Billy?" Those children that tend to be more open or inquisitive don't mind if you ask them direct questions such as, "What's your name?" because they enjoy informing you of the information that they know. Another thing you could do is do a simple recognition of something the child might be wearing. For example, "I like your Spider-Man shoes," or "That's a nice little barrette you have in your hair." All of these, again, helps to encourage the child to open up and be comfortable with you. Always use the child's first name because this has a positive effect and will make them feel more comfortable. Communication. Communication is key. Always make sure you're using developmentally appropriate language. Describe what you will be doing and the equipment you will be using in the way that a child can understand. It's important to remember that with primary grades, present each step as you are going along as simply a new game or "this game is fun." For all ages, use verbal cues such as "now we're going to do this," and "the next thing is for us to do is this." This, of course, facilitates a flow with the process. When we look at the equipment, we can call certain items by certain names. So our vocabulary is also important. For example, the occluder. What could we call that? A spoon or maybe a flat ice cream scoop. Our Randot stereo acuity, you could focus on the use of the special glasses. The 3D glasses, many children are quite familiar with those. It's also important to remember, even in the senior grades, to inform each of them of the steps as you go along. Again, we will talk about communication. Appearances can often be deceiving. Be careful with what you assume about a child's developmental level and ability to perform the test. Primary grades, what do we look at? Does the child know their letters? Does the child call the letter B the letter D consistently? This is something to be aware of, especially in doing the vision tests. Is it that they're calling the letter B and D, mixing them up because that's what they do, or is it because they can't see it? It's important to retest that in order to make sure it's not just that they mix the letters' names as opposed to not being able to see the letter. It's also important to be aware when you're communicating, when you're holding the occluder, you could also, with the primary grades, ask if they can hold it. Don't assume that they can do it properly, though. So one task you could do is actually show them how it's done and see if that makes them more comfortable. If you notice that they're not doing that well, that's when you can step in and say, "Well, I think I'm going to help you with this here." Be very aware of your own nonverbal communication. First thing to think about is personal space or our invisible boundary. This has to be respected with children. For example, leaning over them, standing too close. All of these can make children feel uncomfortable. With the occluder, if you're having to hold the occluder to their face, explain. "I'm just going to hold this here to cover your eye." Don't assume you can just do it. Be aware of your own facial expressions, your voice, and your tone, especially when the children are not doing well. Be patient. Hurrying increases anxiety in children, and be calm. Another important issue is to be very confident. Children can pick up very quickly on working with people that are not confident. When they feel that you're not confident, they won't feel confident either. Make sure you do not rush. Again, rushing increases the anxiety in children. Only give choices when choices exist. For example, a choice such as, "Would you like to sit down here on the chair?" is not a good idea if it's not really a choice, so don't make it sound like one. Give specific directions of what you want them to do. For example, "Let's sit down in this chair. Hold this in this hand." All of these, again, helps with the flow and the process of the visual exam.
We need to be careful with phrases or statements that people often make when trying to encourage children. Words have a lot of power, so saying "this won't hurt you" or "this is so easy" might mean something else to the child different than what it means to you. For instance, the word hurt has a different meaning to each child. What is their experience with people saying "it won't hurt you"? So they might have had a bad experience in a clinic or at a doctor's office or anywhere in general where someone has told them that something won't hurt and they remember that it actually did hurt. So saying that could trigger a child. They also might wonder why you even mentioned the word hurt to begin with. Another communication phrase that might confuse a child is saying "this is so easy." When we say "this is so easy," if a child can't see very well or isn't able to read the letters well, and we tell them that this is so easy, they might feel uncomfortable or embarrassed because for them, it isn't easy and they're not actually able to see it. Remember, the test may not be easy for every child, especially if they don't know their letters well, if they're uncomfortable with strangers, or again, if they actually have a vision problem. And lastly, remember to praise, praise, and more praise. Speak genuinely like you mean it and appropriately. Be positive and encouraging. Say things like "keep going," "you can do it," "you're doing so great." Provide compliments. For the primary grade, you could say "you know your letters so well." They may not have read all of the lines, but they can take pride in accomplishing a task, and it encourages them to continue their efforts. It encourages the child to relax, it decreases their anxiety with performing, it has an overall positive effect. We all like to know we've done well or are doing well. In turn, no matter what age or grade the child is in, we know that praise will increase participation, which is a key factor in performing vision screening in children.